Well, good morning, everyone. It is Friday. That means it's time for a compilation video. This week we've been talking about postpartum particularities, looking at postpartum hormonal changes, pelvic floor changes, and then sexual health as well. Our languages this week were Hausa, Lakota Sioux, and Albanian. So there you go. And now you can look at those every week because I saved them as of Instagram Live, so you can learn how to say hello or good morning in those languages if you ever meet anyone who speaks that, which most people probably won't, but if you do, now you know. So, we were talking a lot about, obviously, postpartum things. I had some pretty, nice responses to this, especially to the new format on Instagram Live. So I'll keep doing that and kind of see. Obviously, with that, you can share with your, friends, colleagues, and if there's anything on there that, you feel you need some help with, or someone who does, please reach out, let me know. Like, I'd love to be able to help you get that help that you'd like to have. So, in terms of postpartum functioning, remember that the postpartum time period technically lasts from delivery basically until the 6 weeks following delivery. The old term for that was the puerperium. We talk about a lot of postpartum changes though occurring in the first year after delivery. And so, so that's kind of the time frame that we use. Now, when you look at these things, it's very much postpartum issues typically arise from one of two things: either a change from pregnancy-related, hormone levels, physiology, stuff like that, or from things related after birth. Now, there can definitely be differences that arise, months after delivery, especially depending on how things are going with you and your, if you have a partner, your child, things along those lines. But for the majority of this video, we'll be talking about things that kind of arise from either the pregnancy or from the kind of effects of the birth itself. So hormonally speaking, remember that we see a very substantial increase in sex hormones during pregnancy that includes estrogens, specifically more estriol, which is the estrogen of pregnancy. We see very high levels of progesterone, testosterone will go up too. And then after delivery, we see, especially in mothers who are breastfeeding, we see a very high level of prolactin. Now, after delivery, regardless of whether you choose to breastfeed or not, those sex hormones drop substantially. And that's one of the main precipitators for things like postpartum depression, postpartum anxiety, and a lot of the postpartum physiologic changes, especially in reproductive tissues. So things like vaginal dryness or, issues kind of vaginally or with the vulva in that postpartum time period. Coupled with, some of the other things from a sex hormone standpoint, thyroid disease is something, the thyroid function changes with pregnancy, and then afterwards some women will develop a postpartum thyroiditis, or kind of inflammation of the thyroid that can persist and can develop actually into, an actual thyroid disorder. We also see patients who may have had gestational or pregnancy-induced diabetes. There's a chance that can progress to just normal, regular, type 2 diabetes after pregnancy as well. So there's a lot of things that can go on there. And so it's important, to kind of keep these things in the back of your mind. If you were diagnosed with thyroid disease while you're pregnant and after you deliver, you continue to have things like, fatigue and you just feel like you're just run down, your hair, skin, nails are all different, you're cold all the time, go get your thyroid checked. You may have developed an actual postpartum thyroiditis. Now, obviously, fatigue is a hard thing because if you have children, that, especially that first year, it seems like you're not really sleeping much at all. Baby's already, is kind of up at all hours, especially if you're nursing, you may be feeding your infant, every couple hours in the beginning. And so, fatigue is a hard one, but if it seems like it's more than just, hey, a good night of sleep could fix this, that's something that warrants evaluation. From a sex hormone standpoint, remember, like I said, prolactin is it's produced in high amounts with breastfeeding, but even in non-breastfeeding moms, it's still going to be elevated after delivery. And what that does is it inhibits a lot of the release of estrogens from the ovaries. And so with that, you're going to see kind of some quasi-menopausal type changes. You may have things like hot flashes, night sweats, brain fog, mood swings, things along those lines. And then in reproductive tissue, you'll notice kind of thinning of the vulva vulva and the vagina. There may be decreased secretions, more kind of vaginal dryness, and especially with sexual activity, you may have some more pain with intercourse. Now, some of that is very normal, obviously. Like I said, it's just a hormonal change, and if that's just the case, then that will get better with time. How long that takes, that's kind of the question. How long is a piece of string? It could be, it's very variable. But if it becomes something that, you say, hey, I'm a nursing mom, but I'm really having all of these vulvovaginal issues, then, let's chat, because there are things that you can do. We can do vaginal hormone therapy that doesn't get into systemic circulation. It's not going to affect breast milk, anything along those lines. And that can really help with all of those kind of vulvovaginal symptoms. And that plays a lot of, or a large role kind of in pelvic health just in general following delivery. You look at things from a hormonal standpoint, from a structural standpoint, and you can really see how it all works together. In terms of mood things, obviously, or I should say not obviously, but thankfully we've had a lot more kind of light shed on postpartum depression, postpartum anxiety. This is especially prevalent in patients who already dealt with anxiety or depression even prior to pregnancy, or maybe they developed it during pregnancy. So, and often it doesn't manifest in the same way as your kind of, quote unquote depression manifests. Like, these patients may not feel sad. They may not feel, just withdrawn, but they don't want to get out. They don't want to be around other people. They kind of hermit and isolate themselves. They may feel like they can't let their baby out of their sight because something may go on, and so they really just become so focused on that, taking care of their infant, that everything else kind of goes away. And that can be really draining and really, problematic for relationships, for, just your own psyche. If you're constantly in a state of heightened awareness, is baby breathing? Like, what's going on? That kind of constant fight or flight type adrenaline reaction can be very, very tiring. So if you notice that you're like, hey, I don't want to be around people. I just can't let my baby out of my sight. I don't really want to engage in things that I used to enjoy. Things aren't as, fun or happy as they used to be. Those are signs of postpartum depression and postpartum anxiety. Let's talk about that. There's things that you can do, or talk to your obstetrician, or actually a lot of times, new parents will find their pediatricians for their, the providers for their baby are the ones actually doing that screening for postpartum depression. So, and that's fine too. In terms of pelvic health, remember that the pelvic floor, which is that kind of hammock of muscles that helps support all of our pelvic organs, but also is, integral in breathing and sitting and posture, walking, pretty much living, is very much stressed during pregnancy and especially during delivery. If you labor at all, even if you end up having a C-section, that pelvic floor has taken a lot of trauma. And so, it's definitely something to kind of consider. And so a lot of kind of postpartum pelvic floor issues may manifest as pelvic organ prolapse. You feel something's kind of heavier or more quote unquote fallen in the pelvis. You can have some urinary issues, whether that's leakage of urine or actual full-blown incontinence, both of urine, possibly even of, feces or stool as well. And yes, a little bit of that is to be expected, but if you're like, man, I can't control my bladder at all, or I can't control when I pass gas, or if I, have a bowel movement, that is not normal. That is not just a postpartum change. So go talk to your obstetrician or your midwife and say, hey, something is different here. There can be what are called fistulas, which are like little tunnels that connect from either the, bladder to the vagina, from the bowel to the vagina, from the rectum to the vagina. And if that occurs, if you have one of those fistulas, you'll have urine coming out of the vagina, if it's what's called a vesiculovaginal fistula. If it's a rectovaginal fistula, you may notice kind of like passage of bowel gas from the vagina. Like, that is not a normal thing following delivery. And obviously, if you have more substantial obstetric tears, those things, the possibility of those go up, but they can occur kind of de novo, too. So the other thing, obviously, with a lot of pelvic floor weakness, you may have some pain with movement. You may feel your hips or your, just whole pelvis is not working well. Definitely pain with intercourse can occur with that, and typically what's gone on is those muscles have kind of been stretched out, and yes, now they've kind of gone back together, but maybe they don't line up completely correctly. Maybe some's over here, or this muscles are like, whatever, peace out, I'm going to Mexico. And the other side's trying to compensate. And that's what we see, is this kind of compensatory type effect, where you have lots of small, little teeny muscles trying to do the job of bigger muscle groups. And so, you get pain. It's like I've said before, if you have a, spasm in your trapezius here, your delta, or like in your shoulder, and someone comes along and is like poking you, you say, ow, that doesn't feel good. Please stop that. Well, if that spasm is in your, some of the pelvic floor muscles with penetrative sexual activity, a penis may be just hitting that muscle over and over and over again, and that hurts. But it can also occur. The other thing is, with extremities, like if you have a sore muscle in your arm or something like that, you can kind of splint that. You can kind of hold it so you don't use it. You can't really do that with your pelvic floor. You're breathing, you're going to the bathroom, you're moving, you're walking. That muscle is going to be constantly aggravated, and so then it starts to recruit other muscles, like in your low back and some of your abdominal musculature, and that we haven't even talked about diastasis recti. That's something that can definitely happen. But all those things kind of, compound to make pelvic floor issues more of a problem. So what's the treatment? What's the main thing? Primarily gold standard pelvic floor physical therapy. If you don't have a pelvic floor physical therapist, in your kind of postpartum team, I strongly recommend getting one. And if you don't have one close by, reach out. We can find, people that can help with that for you. So these therapists can work wonders in getting you back to normal kind of pelvic function. And like I said, that's not just sex, that's things like movement, bowel, they're taking care of constipation, urinary issues. Just things to make your daily life better. So like I said, pelvic floor PT, bar none, treatment of choice in the beginning. Now, obviously, there can be things that are related more to, like an improperly repaired obstetrical laceration, or maybe if you tore at home, let's say you're having a home birth and it didn't heal properly or whatever it may be. Those are things that, sometimes do require more surgical fixes. And if that's the case, that's fine. Like I said, send me a message. I do tons of those, so we can definitely kind of work with you about how to find someone to do it. Or if you want to come to Tulsa, I'm happy to, to take care of you with that too. The other thing, that we see a lot of times in terms of postpartum pelvic functioning is painful intercourse. And this is something that can occur as a result of, like I said, the pelvic floor issues, but also can be due to those hormonal issues like I was talking about. If you have vaginal dryness and you're not using any type of lubricant or moisturizer, it can make things really uncomfortable. A lot of couples feel pressured to resume sexual activity soon after delivery. A lot of, patients say that their spouse is like, hey, when can we have sex? When can we have sex? Like, don't be in a rush. And I know it's easy for me to say, but I have patients that literally go, 8 months, 9 months, 10 months without having penetrative sexual activity. Like that, there's nothing wrong with that. It's only a problem if it's bothersome to you. And that's you, patient, not you, not your spouse, not whoever, not your mother-in-law being like, well, have you started having sex again? Whatever it may be. That's if it's a problem to you. And so if it is, then let's figure it out. Let's see what's going on. If an action is painful, we innately do not want to do it. So if sex is painful, your sex drive is going to be lower. If it's a lot of work and you're not getting much out of it, if you're like, yeah, it's fine, but I'm not enjoying things, I can't, focus on it, the baby's crying, whatever, you're not going to want to do it. Humans are innately lazy creatures, and we really only want to do things that make us feel good and provide some benefit to us. And yes, I understand you can get into like realms of obligatory sexual activity and I want to be a good partner and things like that. But the more you do that, the more likely you are to have an unhealthy relationship with your sexuality. So my advice would be, take it slowly, wait until you are ready to do things, and make sure that if you are with a partner that they're like taking care of you, not just sexually, but obviously like, supporting you with things like helping around the house, or your home, taking you out on a date, whatever it may be, because a lot of times new moms get into this kind of, what I call a saint and seductress dichotomy. You are this nurturer, you have birthed a child, you are taking care of this child, you are being kind of this mother figure. There is nothing innately sexual about that. Obviously, you are, like I said, nurturing. It takes a little bit to switch out of mom mode back into your seductress self. And that takes time with, like courting and going on dates and feeling emotionally, taken care of. And so this is something that, is a really important thing to talk with your partner about, and say, hey, I need to feel these ways. If we want to engage in more kind of adult, happy, fun time, then I need to feel like an adult and not just a caretaker. So obviously there's so much more to talk about here. I know we're kind of running a little bit long in the video, but I just, like I said, if you have any postpartum issues, these are very, very, very common. Send me a message. Let's get you, help you get on the kind of road to recovery that you need to, that you want to, that so that you can kind of live your best life and be your best self. So anyway, I hope you have a wonderful weekend. Take care of yourself, and I'll talk to you later.